Hey, my name is Jessica Goins, and I'm a nurse practitioner and owner of OptimLife Health in Dallas, North Carolina. And this is my husband, Bradley Goins, and he's the co-owner of Going Strong Fitness, which we created in 2017. So we just kind of want to talk a little bit about both of those.
How everything fits together.
Yeah, and just we'll see where it goes.
Mm-hmm.
So,
Yep, sounds good to me.
what do you want to talk about first?
Well, I want to talk about, make sure people understand what you're doing. You did another video where you talked about, Mandy's blood work. But, for me, in the healthcare, so I don't go to the doctor very often because I don't feel like I ever got a level of care that fits what I would want. Like, I've always been more of an athlete-minded person where I'm trying to optimize my body and perform the best that I can, but I don't feel like the medical system could really help me with that. They don't really test certain blood work markers. Anybody that's actually understands getting your blood work checked and checking for deficiencies and trying to address those things, you can't really get anybody to work with you on that.
Right, so you just mainly use it for sick care.
Right. Like if I got sick for a few days, it's like, I gotta go to the doctor to make sure I don't have something serious, right? But, for me, I want somebody to be proactive and help me get to the best possible place that I can be. Yeah, I'm not gonna be an NFL athlete, but I wanna be able to perform good. We have businesses, we got the gym now, we've got kids, you've got this, and if we're not on top of our game, you don't feel your best, you don't perform well, then things, they may not fall apart, but you're playing life on a high difficulty mode. And I just want to talk about what you're doing, how it's different than regular primary care, especially the insurance-based system, how it's different than even most direct pay, non-insurance primary care situations. Membership medicine, there's different names for it, concierge medicine, which is that's more like what you do, but you take it a step further and are doing levels of blood work that I don't think most of those providers are even doing in working with their patients. So,
I'm doing things I didn't know that I was going to be doing. So I felt like 5 years ago, I knew I wanted to do this. We knew we wanted to tie it into the gym. We knew that to take care of patients, I would need to be a nurse practitioner. I think in your mind, you knew it was going to be medical more so. In my mind, I was thinking, well, I'll tie that cosmetology background in and it'll be,
Right.
med spa. Then after being at the hospital, seeing those patients, yes, they had some acute issues, but they could be optimized for where they are, prior to leading up to what they had going on, right? And they were always talking about how they couldn't get the care they needed in the outpatient setting. Couldn't get anybody on the phone, it's hard to even get a person to answer the phone. You call,
Right.
You're even stuck in the system, press this button.
Yep.
They may call you back, triage nurse, whatever. 4 weeks to get an appointment, 6 weeks, 8 weeks, whatever. So it was kind of like, being there, I realized, maybe I actually do like primary care. I want to help. I felt the need to help. So we're like, fast forward, we're here. We're like, we need to focus on hormones. Hormones tie into everything and we can optimize our gym members. Well, I'm starting to look up what are the best panels that I need to be checking?
Right.
What does that include? So not that I thought it was going to be just sex hormones, but it turned into it's not just testosterone and the estrogen
Right.
and all that. It was the thyroid's super important. The inflammatory markers are super important. Of course, I knew that I was going to be checking for insulin resistance because we talk about that all the time.
Yeah.
We have running jokes about that.
Right.
So it's kind of it's vitamins, it's mineral deficiencies that I'm seeing. So it's this whole comprehensive panel, and it's not just hormone optimization. You can't even say that. It's
No.
Total body optimization.
Whole body.
So then it's I'm rethinking the business model, right? Because it's we have this hormone optimization membership and we have this direct primary care. And I think that we need to put the message out there that, hey, I'm not trying to say I'm amazing, I'm whatever. I'm just trying to tell you
But you are.
what we have stepped into and fell into, or what God wants me to do, is completely different than what I thought. And I'm offering everything in that hormone optimization
Yep.
membership. So we're going to have to combine it and say,
I agree.
this is direct primary care, because these patients are coming in. They go to regular providers, they go to nurse practitioners, they go to PAs, they go to MDs. I've seen it all. They go in this community, they go to hormone specialists in Ballantyne, wherever, but they end up right here in this office for whatever reason. And they're telling me, I'm tired all the time, or my provider just tells me that I need to exercise more and eat better, or
Which tells you nothing.
I'm just getting older, or whatever.
Yeah, like you're supposed to accept
so
the
they're
inevitable.
making it here,
Yeah.
and then I'm like, okay, well, I'll check everything, because if I check everything, what's the harm in that? It's not like I'm checking crazy stuff.
It's
that I
just
don't
information.
need to.
It's data.
Yeah.
It may
it's
tell you
like,
something. It may not tell you
it's
anything.
like a baseline.
Right.
So like, let's say you don't have an issue in this area, great. But I have a baseline. So if you have an issue in the future, we can track it.
Right.
But it's like, you can get all that. I sit down with, like, literally, I've been in clinical, right, for school. And it's nothing to say bad about who I was with. I was with some amazing providers. Like, they cared. But they were pushed to the max on their time limits. Like,
Yep.
they had like 10 minutes with the patient.
Limited time
Yeah.
with patients.
So, you know what would happen? They'd had their labs done maybe prior to the appointment. And so they go in, and that day, the patient does, and they're looking at the labs that morning, printing them out.
Yeah.
Yeah, you know.
Looking
okay,
at
well,
looking at what gets flagged.
Well, your lipid panel.
It's not out of range.
Your cholesterol is a little high, or your vitamin, if they check the vitamin D, is a little low.
Right.
So I would see that, or you just see that they came in, they talked to you, they listened. Then you get your lab done that day, and then they communicate with you through the portal.
Yeah, right.
That's fine. That's fine. A lot of them do their due diligence as far as if they did check something that it was off. They're like, recommend like in the little note. Okay, sure. But you need that inpatient experience.
Sure.
So that way, when I'm telling you,
That's
why
what people
you
prefer. I prefer in person.
It makes sense,
It's
it connects,
personable.
You'll do it, or
Right.
at least you're more likely to do it.
Yeah.
So I see that, and so it's not a knock on the providers; it's a knock on the system.
Yeah, the system's not built to
If you're
provide
seeing
time to the patient.
20 to 30 patients a day,
It's impossible.
and you have to chart on them.
It's not possible.
No. So I'm spending minimum 30 minutes with the patient. Minimum. If they don't, like, I let them dictate. Like, we're in there up to an hour usually. It doesn't take longer than an hour usually. And if it did, it did.
Right.
So I do my schedule accordingly.
Right.
When you call, you get a live person. You
Yep.
get Mandy.
Mandy's answering the phone.
She can tell you anything.
Yep.
Guess what? If you need to talk to me, I'm gonna call you that day.
Yep.
You email me, I'm gonna email you that day. So you're getting, you're getting the extensive lab work,
You're getting follow up.
which is everything. Yeah, you getting follow up. You need something, you reach out, I'm there. So I can't say I'm giving the hormone optimization members direct primary care.
You are.
So that's why it has to be different. And I think that that's how healthcare should be.
It's exactly how it
But
should
people
be.
are brainwashed to use their insurance. And
Right.
insurance is a scam. I'm just going to say it.
It is.
If you go to the hospital because you had a wreck or you had a heart attack, they're going to save your life. Like
They
that.
will save your life.
So that care is great, and
Yep.
insurance is good in that instance.
Correct.
I think
There's no incentive for
the
prevention.
doctors who are saving your life, like the hospital doctors, they're amazing.
Right.
But as far as insurance in the community, in outpatient setting, it's tough because they limit what you can do, what labs you can check, what prescriptions you can write.
Right.
There's no reason
They
that
basically-
I shouldn't be able to write a man a prescription for testosterone if his levels
If-
are super low and he's symptomatic.
And he's symptomatic. Yeah, I agree.
There's no reason.
Yep, and that's where men specifically, just being at the gym. And we've talked to a bunch of people over the last 7 years. I mean, they come to me to ask my opinion on all kind of stuff like that, and I'm like, you need to get a different primary care.
And what do they do? They end up usually finding it and self-administering it because they know they're going to get judged so hot and heavy in the normal setting.
What happens is they go, they don't feel good, and so the medical system doesn't want to address. They just say, oh well, let's say the bottom range for testosterone is like 250 on your.
I think it was actually one something.
Well, because they keep lowering it, but all the lab test stuff is based off of an average of the American or the populace.
Even ours goes only to 600 something for a man.
The top range?
On the labs I've been printing this week, I'm like, what? It's like 140, one something to 600.
Okay, yeah, but I mean,
it's bogus.
Yeah, no, but the bottom line is, it's like, okay, but if you come in at 251, right, and 250 was the bottom, and you're symptomatic, you're in range. And so insurance says, we're not covering anything. Doctor says, you're fine.
You're fine.
Never mind, you have zero libido, you feel
Zero
zero energy, you feel terrible, you're falling asleep in the afternoon.
You can be depressed.
Clinically depressed. And many men, when they initiate therapy, those depressive symptoms either subside or completely go away. That's well known. Anybody that's ever.
And then they have more energy to want to take care of
Right.
themselves.
Then you actually want to go to the gym. Then you actually get healthier. And then your lipids improve. And so there's these downstream effects of this kind of stuff. And there's some stigma with it. You're not talking about like massive bodybuilder level stuff. We're talking about just like normal, safe, therapeutic dosages that get you back to a regular level that are normal for people.
And let's be clear, it's something that's naturally made.
Yeah. It's not foreign to the body.
Yeah, you are giving it back in its natural form. Like, it's not like something crazy. It's not like you're going and buying A, B, C, and this, and then trying to get that up. Like, you're replacing
Right.
what needs to be replaced.
While we're on the subject of hormones, we've talked about this, and I think what's always really funny to me is perimenopausal women or menopausal women or premenopausal women, maybe their testosterone's low. They're not going to prescribe a woman a low dose testosterone, even if it's indicated that they could benefit from it. We know they can benefit from it because we see it in clinic with the lab work, and we know that they're getting massive benefits like reduced rheumatoid arthritis symptoms when they initiate, stuff like that. That's just an example, but just libido and feeling better. But in the system though, like, a 16-year-old comes in with irregular periods. They're like, here's your synthetic estrogen birth control, right? Here you go. We just hand it out like it's M&Ms, and everybody's on it, and it's synthetic estrogen, and it's messing with your hormones. It's that is worse than trying to replace a therapeutic level of testosterone or estrogen, say a menopausal woman. Right. If you're giving somebody estradiol, if they have a clinical need, I'm not saying just give people, hormone replacement, but if you are
like, there's no reason. Like, it's terrible when you have like a 40-year-old
who's
still on hormonal birth control,
and they have been for 20 years or more.
That's not.
And
good.
it's known to have
suppress their hormones so much over time. It increases like depression, anxiety. It's really not good for your body composition, honestly.
No, it's not.
So then you're on a antidepressant, anxiety,
and you struggle to lose weight.
Sometimes there's a need for that, but
I'm not saying there's never a need for it, but I'm saying we will.
If there's a woman who doesn't want to get pregnant or whatever, if she still can,
right?
But there's also non-hormonal IUDs. There's other ways, but it's a person's choice. I'm just saying, like you said, there's throwing them on it at a young. Like, I was thrown on it at a young age.
Right.
Just because I had.
Did they talk about the long-term
cycles.
effects or the side effects of it?
No.
Did they tell you how, a lot of those things will say, there's a few of them you're not supposed to be on it for like 10 years, but people are on them for like 10 years.
Yeah, and then
it's
what did I
supposed to be
end
short
up
term.
on? I ended up on citalopram, anxiety, depression, for 10 years.
Right. Which
Now
you
I'm
came
off.
which you came off of.
Yeah.
Yeah.
But and not, and there are certain, so I don't want this to be like a judgy type thing. You have people who need that stuff. But I think that the reason why I ended up needing an antidepressant was because I was slapped on birth control at 14. And then I got the medication around 20 years old.
Yeah.
In a stressful time. A lot of times
Sure.
those are meant for short term. I never could come off. That's what's sad. Like, if you never can come off of it. And there's some people who have to have it long term.
Yeah.
But the point is, I'm seeing it here now. I'm seeing it suppress women's hormones to a point that they're symptomatic more so.
Or they have issues that doesn't seem like should be normal,
Yeah, so
like
if they're in a
ovarian
position
issues.
to come off of it, and some of my ladies have been able to come off of it.
Right.
Good, fine and good. If not,
Yeah, I'm
not.
not.
Yeah.
No, I'm
So
more
we
talking.
can-
I'm more talking about how the system will have a stigma on one thing, but then we do this other thing that
Yes,
we're
like,
we're
we
messing
can't
with.
give this man testosterone because he needs it.
Right.
He's low. He's 45 years old. But by all means, let's slap the synthetic.
Right, or somebody
estrogen and
wants to change their
progestin.
gender. Here you
Yes.
go. Like, okay, and I'm like,
Yes.
well, that's fine if you
Right.
want to do that, but like, let's not
Yeah.
give this guy a hard time because
Yeah.
he feels like doo doo.
Literally, I've had several of my patients come in, tell me how great they feel. They're on either, let's say that it's a lady. Let's say she's on testosterone.
Yeah, let's talk about some of your people
Yeah.
some of the benefits
Okay.
that yeah.
So I have one lady for sure. She came in. She's on testosterone, estrogen, and progesterone.
Right.
She needed all three. She was symptomatic.
Her blood work showed she
her
needed it
numbers
or could
supported
benefit from it.
Yeah, and she feels amazing. She's not having joint pain. That was chronic.
Yeah.
For her.
Right.
I have another lady who just, let's see, she only needed testosterone and progesterone. Okay. She was also having migraines. Well, I'm looking it up. She's had different treatments for migraines in the past that would cause her to go too low in her blood pressure or something like that because she has, low blood pressure at baseline, not really elevated.
Right.
So she has to be careful with that. She's tried like injections, different things, and I'm like looking up, natural things to help with her migraines,
Mm-hmm.
So here I am. This is a good example of this is not necessarily hormone related. I'm seeing her testosterone, progesterone therapy, but here I'm managing.
This is where you're crossing
headaches.
into the medical
Yeah.
side
so I'm
of
like,
it. Yeah.
I look it up and it's like, she can take CoQ10 in the morning and riboflavin, or however you say that. I always pronounce every word wrong. Riboflavin, whatever.
Is CoQ10 part of it?
Yes.
Oh.
And then she
Well, I
takes
haven't had any migraines since I started taking CoQ10.
See, she takes magnesium at night,
Yeah.
so that
Right.
synergistically works together,
Sure. For sure.
and that's helping her, right?
Right.
So anyway, but she's like, I'm feeling great, but she has to go to her regular provider for whatever checkup, whatever, and they're like, well, we don't support the hormones, and it's just like,
It's like, well, why? What clinical basis? And then they almost never provide a clinical basis when they say that.
it's
They
just
say,
not good.
We don't support it. It's just not good. It's like,
I'm not
okay,
at
but
liberty to say.
can you give a clinical basis as to why?
Right.
Because you're checking, and I just want to clear this up. When you're looking at blood work and that's data. I'm an engineer by degree, and I'm like, what does the data show me?
Mm-hmm.
And if I have the data, I'm looking at it. It says this. This is low. This is high. Whatever. Okay, well, maybe we can tweak that by administering something. You have a basis.
Right.
I'm looking at a blood marker.
and you
that-
will recheck it.
And we're going to recheck it, and we're going to see how you respond to it. Do you become less symptomatic, or do your symptoms completely disappear? And you're being monitored closely,
I
so
don't
it's
know.
very safe.
Maybe it's because they can't provide the monitoring.
No, the regular system cannot provide the monitoring, and I'll tell you why. They don't have time to. They don't have time to.
Right.
Because if you put a woman on a low dose testosterone, this is my opinion, they can respond differently to very small dose
Right,
changes.
right.
They can respond very
Yes.
very high. So you need to monitor them. So it's not something you should just willy-nilly do. And it's just, you need to monitor it's really just about doing it safely and monitoring side effects and make sure you're doing it in a proper way, because you don't want to get somebody too high, because some people
But it's-
absorb the skin
That's
different.
no different with anybody. Like, Hypothyroidism
but
has to be monitored.
yeah.
Hypertension.
Well, every drug that they give
a
you, it should
diabetic
be.
has to be monitored. So they're treating these patients in the outpatient setting who have multiple comorbidities. They have hypertension, they have hyperlipidemia, they have diabetes, they have chronic kidney disease, whatever. They have all those things that are serious.
Yes.
That need to be monitored.
They all tie back to the same
But
issues.
by all means, I have a healthy, for the most part, patient who needs, testosterone or progesterone or male or female, whatever. But let's don't replace it, because
Yeah. Right.
Sure, if there's too much testosterone on board, or the person responds by making way more red blood cells and their hematocrit gets too high, you have to know.
That's going to be more in a male population.
Yeah, right.
Yeah.
That's exactly male. You have to know how to check and follow and look for that. Do they need to go give blood? But that's why you have me.
Yeah, exactly.
I'm checking, I'm doing. So it's not like I'm not a cardiologist. I'm not seeing those type of patients. To me, that's scarier.
Right.
Hormones are not scary.
No.
But I guess it's just not the standard of care.
They're actually less likely to have the side effects of many of the drugs they administer in regular settings.
I've seen a couple of urologists, I've seen a couple of MDs give testosterone in the outpatient. Some of them do it okay or whatever. Sometimes they won't go over 100 milligrams a week, whatever. But so I don't want to say, blanketly, I'll say that the system doesn't do well with it.
Yeah.
But there are great providers out there who will step out. But you can only step out as far as insurance or different things like that. So that's why I don't. So patients are like, can I use my insurance?
And you can't.
You can use it for labs.
It's not going to get you anywhere. You can use it for labs, but it's not. They're going to deny everything.
It's going to limit us. It's going to limit our care. It's
Right.
going to tell me what I can order, what I can prescribe.
Yes.
I'm not trying to be renegade, whatever, but I'm trying to take best
but
care. To take best care, I have to order all these labs.
Right, but that's why direct care.
I have to do these.
But that's why direct care medicine exists in the first place, is because the insurance companies have been this way at least since. It's been a very long time.
Mm-hmm.
But the Affordable Care Act didn't exactly help. It gave more, I think, power to the insurance companies to sort of be that way. And you got to a point where now if you want actual preventative treatment, where you're actually getting help with these types of issues, like with what you're doing, the insurance company will not pay for most of that. If you're obese, they might pay for a dietitian, but how do you know you got a good dietitian? We know from the fitness side that, if somebody is 100 pounds overweight and diabetic, and they're telling you to have this many carbs you have to have this many carbs at this every meal, and it's like, well, no, you're insulin resistant. You need to have a lower carb diet, maybe not no carb diet, but it should be lower.
Carb, but it should
And now if you're injecting insulin,
and it's important what they're choosing. Like, I shouldn't walk into a patient's room at the hospital of a patient and I don't mean this ugly, but she was legit 300 pounds, and her breakfast consisted of pancakes and regular syrup.
Yeah.
What are we doing?
Well, yeah. Well, in the hospital, hospitals.
That's one example.
Yeah.
I'm just saying. So,
most people are going to choose that because they don't understand that that's what the problem is.
Yeah.
If you don't know, that kind of food is the problem. You don't get big overnight.
It's not just medical. Like, okay, yes, I am definitely what we said, doing all this lab work, reviewing it with you. It's direct primary care, so it's like, and I'll say this too, it's a membership model, so you're not paying me per visit. It doesn't work like that, because that would be a higher cost, and that could be a hindrance to you actually coming in. So it's
just think of it like a cable bill.
Yeah, it's a reasonable amount per month. We follow with each other, right? Like, I've got you scheduled. You're always on the schedule. You can call me. I think I have a sinus infection, or I've got this going on, whatever. But it's always that. So, what I'm trying to say is, it's not just that. I can help you lose weight. I can help you with fitness.
Right.
I'm in a position. We
have
are
the
in
gym.
a position to show you how to work out, to show you how to eat. So a lot of times my visits take so long because we're sitting. I'm not, if it's a medical weight loss, I'm not just sitting in there talking about, oh, your numbers. We're talking about how you've been doing, how you've been feeling. I've done blood work on my medical weight loss, people.
Right, which nobody else is doing, by the way.
So the medical weight loss,
not very much blood work
the
anyway.
medical weight loss, you come to me thinking you want to lose weight, but I'm optimizing your whole body because I need your labs to know what's going on in the background for the baseline, right? So we're sitting in there. I scan you, I get your baseline of that, right? Of how much muscle you have, body fat, whatever.
Right.
I find out your eating habits. I find out all those things. We get your blood work. You come back in. We extensively go over the blood work. So like, okay, so we can optimize this. This will help you lose weight. Now then, when you come in for your check-ins, we're talking about that diet. What actually worked? Did this, like, some people want to start with, they just need to eat more protein.
Yeah.
And they don't want to be severely limited. So I'm not strict, like, it has to be this way.
Yeah.
But if they want it, I'll give it to them. So you're learning how to eat.
Right.
You're learning how to move your body. So it is I don't want to say one-stop shop, but
no, this is a one-stop. This is a one-stop shop.
Well, I mean, you're
this
not
is a
going to work
one-stop
out
shop.
while you're in here, but you can go down the street to my gym.
When you're doing that, that's primary care with real preventative care, real blood work, real whole body optimization, on top of medical weight loss. So when people will go spend thousands of dollars at a medical weight loss clinic and get nothing but a couple shots and some frou-frou red light therapy or something and pretend we're going to do something to make you feel like we're doing some kind of treatment. Or they give you a B12 shot, right? They have you come in weekly, give you a little B12 shot. That ain't doing anything. That's not doing anything. That's not how you lose weight for long term.
No.
You are doing everything that we know from the fitness side with the medical, where we can do a detailed diet plan. Now, like you said, some people aren't ready for that.
Yeah.
But I can tell you exactly, here's a template. This is exactly what you need to eat for your current weight and what the activity level, here's a workout plan. Because we have the gym, here's a workout plan. I've met with a few people and had taken them through a workout plan and said, here, implement this, right? I'm not going to hold your hand every time you come to the gym, but I'm going to take you through it, show you how to do it.
Because that's the point. They need to be able to sustain.
You have to be self-sustaining eventually, right? And then there's follow-up, because they're going to follow up with you and rescan every month or every 4 weeks and check in with you. And, and there's a touch point, like if they see me at the gym, like, because it's just down the street. People that are local will use our facility and they will see me and they, hey, I got a quick question. Okay, cool. I got you covered.
Right.
That's what we do all the time. That's what I've done for 20 years anyway. Well, since I was 14, 24 years. But nobody is doing that. It doesn't exist. This does not exist anywhere else, not to the level that you're doing. Nobody could actually do more than I think is happening right there. This is exactly what I think medical care should be at a high level.
Yeah.
Like, this is celebrity, like Hollywood star level top treatment, because you're getting
It's everything.
You're getting all this blood work. You're looking at all the issues. You're getting basically a plan that will work if you follow it, because we've done this for how long, right? This is not like, you can replicate this. The only reason these types of plans don't work is if you don't fully implement it and fully adhere to it. But now with like GLP-1 medications and things like that, it helps people with the psychological part. And I think just from a fitness standpoint, that's where I want to break the stigma too with the GLP-1s, semaglutide, tirzepatide specifically, the Wegovy, Zepbound, Mounjaro. Implementing that with a plan for medical weight loss. The biggest failure I think we've seen in the fitness side is adherence to a diet and not being able to, they want.
Because you can't out-train a bad diet.
Because they'll say, I followed the diet, but before I go to bed, I got to have a bowl of ice cream. I had to have a handful of Oreos. I'm like, no, did you? Did you have to?
Yeah.
And people have a binge eating habit. I get it. I have it from when I was younger. I like to binge eat Doritos when I was younger, and if I ate a chip now, then I would eat the whole bag. So I mean, I get it. But these medications, I think, are beneficial in that they kind of help turn that switch off in that habit.
Help turn it off so you can
or tamp it down.
Get
If it
some
doesn't,
results. But you have to build the habits though to be able
right,
to say
right,
no
right.
later.
Yeah,
You don't want to be on
you
it forever.
cannot.
You don't.
Just want to share this because we know this. You cannot just take the drugs, the medications, and because I think what's happening is a lot of doctors. Maybe the patients demand it too. They want to get on that high dose because they think more is better. And really, just even experiment with myself, more is not better. It increases the side effects.
Yeah.
And so when people.
It makes you not eat, and that's why they're losing weight.
And
so
so
if you're taking a high dose, you're losing weight, but you're losing muscle.
Well, you're not eating.
Fat. Yeah, because
right.
you're not eating, so you're not nourished. So people, they think, oh, they've lost all this weight. If you're 100 pounds overweight and your body composition is 50%, and you lose 100 pounds,
right?
Okay, but you didn't change your eating habits. You hardly ate. You didn't eat your protein, and you didn't exercise. You're still close to 50%, maybe 40-something%. If you lose 100 pounds, you're still a poor body composition.
Your body, it's not as good as it should have been.
I've had patients come in, and I think that they have seen so much weight loss like out there with the GLP-1s. They come in and they're thinking, this is going to be good. I've got Jessica. She's going to show me, and they think they're going to lose all this weight. And I have to say, listen, you can only lose 1 to 2 pounds of fat a week.
Yeah. Can
That's
I break the math down real quick on that for people?
Sure.
I mean,
Please.
I'm an engineer. I have a minor in mathematics, almost a minor in physics. Legitimately, I'm not full of it. But so you can a pound of fat is about 3,500 calories. That's just a rough estimate. This is just numbers. It's not, your metabolisms can go up and down. They can self-regulate depending on what type of food you eat. There's the whole thing, but it's numbers basis. That means for 7 days of the week, if you ate a 500 calorie deficit, which means if you're a lady and let's say you burn, 1,800 calories a day just sitting around, or 1,700 calories sitting around, if you don't work out, you got to eat 1,200 calories a day, every day. High protein too, because you don't eat enough protein.
Oh, yeah.
In our experience, if your protein is if you're not getting enough protein in, weight loss will stall. It will stall every time. If you keep your protein high, it tends not to. That's why bodybuilders don't have trouble with weight loss when they're getting ready for a show, because they eat protein. So you're going to have to do that every day. If you mess up one day, you had a cheat day. Let's say you ate a 500 calorie deficit Monday through Friday.
It's the weekend.
It's the freaking weekend, baby. And let's say you had a 2,500 calorie deficit. Let's think of it like a paycheck. You got a weekly paycheck, and you got $2,500 extra dollars you've banked, right? You're in a deficit. You've lost almost a pound of fat that week. Saturday comes, man, you went to Bojangles and got that biscuit you wanted. A little Bowberry on the side, and then sometimes your friends want to go out to the Mexican restaurant that night with a little tequila drink and some salty chips. And them 2,500 calories you had banked,
Gone.
You spent them all. And then you come in and you say on the scale next Monday, and the scale didn't change, and you're like, I ain't lost no weight. I ate good the whole week, except for that day where you blew it.
And it usually turns into a little bit of bad on Sunday too.
Well,
usually it on the whole day, it usually has some carryover.
Well, because we know from experience, we used to do that too.
Because I did it.
So people spend.
I would have a cheat weekend.
Right, and you spin your wheels.
But I just maintained where I was.
Right, exactly. You can do that, and you'll just maintain. But when
if
you
want to maintain.
Right, but when you want weight loss, you got to get serious with it. You got to be on it. And now, if you exercise and let's say you burn 400 calories, that's just so that was weight loss. So now, let's say now you're burning 300 or 400 calories because you're walking and doing some resistance training, and now you're burning 2,100 calories a day, still eating 1,200 calories. Your weight loss is going to be faster. Right, because it's all about.
Just to be clear, these are numbers we don't like for somebody to be that low of 1,200, but some people have to be until we build their metabolism up.
If a lady is 5 foot tall and her ideal weight is 110 pounds or something.
Well, in that case.
then she feasibly would need to be at 1,100 to
Right.
1,300 calories with activity.
We were brainwashed for years, thinking we had to have at least 2,000, 2,500. Like, you know what I mean? The whole, like when we were growing up and stuff.
Well, yeah,
So people,
based on a 2,000 calorie diet was based off of the average male at that time.
exactly.
I think it was like a 135 pound meal.
And then you have the influencers on Instagram and TikTok who are like, I eat 300 carbs a day. You look at me.
Well, you can if you're
weight training.
If you're weight training and you're insulin sensitive.
Right.
If you're me, I can eat 300 carbs a day.
So there are legitimate times where I never like for anybody to be under 1,000 calories, but there are legitimate times, like you're saying, that
yeah.
this person may need to be at 1,200.
Yeah. Well, if you keep your protein high, it tends to keep your metabolism from dropping off. When you don't feed your body the protein it needs, it wants to hold on to everything. That's my experience.
Yes.
That's not just anecdotal. I've seen that in plenty of people.
But if you keep your protein high, it usually keeps you full to where you're not wanting all this other junk, knick-knacky stuff. Right. So like if you, like remember back in the day, we'd go get something from a Japanese place, whatever. What did I eat? I eat all my freaking rice.
Right.
With the sauce on it.
And I got a lot of extra chicken.
And you got a lot of extra chicken. And
Baby,
it's
I can't finish my chicken.
Game changer when you realize I got to eat all of this chicken.
I know.
And
I never got that extra protein anymore.
He never gets my food anymore because I'm hungry and I eat it. But I know the importance of the protein now.
Right.
So my patients.
And you get white rice, don't get fried rice.
Yeah, and people don't realize how fattening the oils are, how much that just adds up in the calories.
Don't cook with oil.
Yeah.
Don't cook with oil. If your goal is fat loss, I don't care if it's olive oil or avocado oil. I don't care if it's coconut oil. Don't add oil to the pan and then saute all your food in it. You're going to add, because I have an example recently where somebody emailed, I was talking to them and then they emailed me the next day. I said, go home, measure the oil you're pouring into your pan when you're cooking, because they had been eating clean in their mind. And they were eating clean, but they were cooking with like an avocado oil, which is a healthy oil. Don't get me wrong, but it's tons of calories. Yeah. If you're free pouring
just a little bit.
You 1 tablespoon is 200 calories worth of fat.
And that's not
And when you free pour in that pan, you can easily add 2 tablespoons like that.
So you don't know what they're doing when you're going out to eat.
Creamer in your coffee, real cream. People forget about that. They don't count that. And so they're counting their calories and they're like, well, I'm not losing weight. Well, this individual was adding like 600 calories per day, every day, by how they were cooking, just in oil.
That's a lot.
And so, back to the mathematics, right? 500 extra calories a day is going to be a pound every week. So if you're cooking every week, that guy should have lost a pound a week. If he'd have take that oil out and those extra calories, he's losing a pound a week now that he wasn't losing before.
Right.
Just because he was eating the food, but he was adding these things on top of it that he's forgetting to count. He's not counting the oil. People forget to count their ketchup. People forget to count their barbecue sauce.
I think where we were going with this too is with this.
Yeah, I think I got lost. I'm sorry.
No, you're good. You can out-eat a GLP-1.
Absolutely, you can.
So that's what I'm saying.
It's not a miracle.
These people were going in and probably telling them, oh, I need to do da-da-da-da. They were getting their dose increased. And that's where I was getting at with, they're not eating anything. But my people, we're starting on the lowest dose. We're staying there as long as we can stay there because, you want to take the lowest, most effective dose.
Right.
Right? I'm teaching them how to eat. So I'm telling, don't be disappointed when you come in and you've lost anywhere from 4 to 8 pounds in 4 weeks.
Right.
Like, that's good.
That's great.
And what we're wanting to do is, if you don't want a hardcore workout plan, at least be walking, stimulating your muscles. I'm trying to.
But your results are better if you do a workout plan.
Ease you into working out if you're not ready.
1 day a week at least. 1 day a week.
I'm working on you.
Yeah.
But you could be building muscle, but you're at least preserving your muscle.
Right.
Right. We don't want to see it lost.
Yeah.
But I've had people go, oh, I thought it would be more weight than that. It's just like, no. These people
it can be more weight. It'll be water and muscle.
Right. These people out here who've lost this all really, really fast, you don't know their numbers. You don't know their body composition. You don't know what they're eating. How long are they going to have to be on it? I've had doctors tell me, well, GLP-1s are for life. Well, they shouldn't be.
They're not.
If you truly learn how to eat, how to prioritize your protein,
Right.
how to manage your carbs, your fats. It's not hard. We're going to help you. We're going to make it easier. So by the time you're done and you get to where you want to get, you should
know
have
what to
these
do.
great habits. You don't need it. Now listen, are you going to stay, let's say you're 150 pounds now and that's good for you. Are you going to stay 150 pounds every day of your life for the rest of your life? No. You're going to have an event come up. You're going to have something. But that's why I encourage, weighing often, because it keeps you in check. So that way, if you did gain 5 pounds,
Right.
10 pounds, reel it in. Be strict for a little bit. Like, nobody's perfect all the time.
No.
But don't be fooled and never get on the scale and think 50 pounds is snuck on you.
I've always got on the scale
you
at
gotta
least
keep
at
those
least
habits.
once a week.
Yeah, you've got to keep the habits. The goal is if I haven't taught you habits that you can sustain, then I'm failing, right? Either
Right.
you just didn't listen, like you just didn't do, or I failed. Like I'm working every chance I get to make you understand, like these are habits we have to build.
Right. I think it's just a matter of setting those expectations. Is like legitimate. Like I said, back to the math, you can only lose 1 or 2 pounds. Anything more than that, and this is a good time to point out, like, this is something that about standard weight loss places, when they say lose 40 pounds in 30 days, you'll see those signs.
Or 40 days.
No, they'll
Is
say
it that?
yeah.
Either way is bad.
Some it depends. They all say
it's all
different.
bad.
They all say different things, right? So yeah, I can get you to lose 40 pounds. I can do it so good. Donald Trump level stuff right there, so good. But 40 pounds in 30 days, easy. All I do is tell you, don't lift weights. And now what do they typically do? They don't
yeah.
want you to lift weights early on. Do you know why? Because it'll preserve your muscle tissue. And when you lift weights, you'll hold some carbohydrate and some water in the muscle.
Yep.
Bodybuilders know this because that's just what I'm into. Don't worry about me. But you're going to hold more water in the muscle, and you're going to be fuller, so you're going to hold more weight.
Yep.
That's not bad weight. That's actually good weight. It's just water in the muscle.
But it keeps the scale from going.
But it keeps the scale from going down. They don't want you to lift weights, so you're going to lose muscle. You're going to lose water in the muscle. You're going to lose water in the tissue if you follow a diet, and you're going to flush water and inflammation initially. So you're going to lose, if you're 100 pounds overweight, I can easily get you to lose real quick, and within a week or two, 15 or 20 pounds of water and inflammation.
Yeah.
And then if I kind of have you on this like low calorie diet, sometimes I've seen people on very restrictive 700 to 1,000 calorie diets for for that whole 30 days. They do that. And you're going to lose a substantial amount of weight. It's just not going to be
good weight.
It's not going to be
fat.
you might lose
some fat.
let's say you lost 40 pounds in 30 days.
Okay.
That's 4 weeks. We'll say that's 4 weeks.
Okay.
If you only feasibly, like we said, let's assume you lost 2 pounds a week of pure fat.
Okay.
That's 8 pounds. Mm-hmm. That means I could only feasibly actually lose, mathematically, 8 pounds. I'm going to give it 10. I'm going to round it up to 10.
Okay.
That means you only probably lost, at best, 10 pounds in that 30 days. Mm-hmm. And if anything else you lost was water and fat, water and muscle. Mm-hmm. And so if you lost 30 pounds, you probably lost 10 pounds of muscle, 10 pounds of water, and 10 pounds of fat. Well, losing 10 pounds of muscle wasn't good.
No.
So really,
and you probably didn't have as much that you needed to start with.
And you probably didn't have much muscle because you probably weren't lifting.
Right.
You want to maintain the muscle and only lose fat and water.
Right.
That's the goal.
Yeah. Because you're going to have, in most cases, you're going to have a little bit of muscle loss if you've got a lot of weight to lose. But you just don't want,
You can use it. But what I'm
that.
saying is, like, to lose 10 pounds of muscle in 4 weeks is a substantial.
that's terrible.
That would be a substantial amount of muscle, and it's
terrible.
very feasible if you're not weight training. Mm-hmm. Your body will. It's more. Muscle is metabolically active, so when you don't weight train and you go into severe calorie deficit, your body says, I can't keep this muscle because I'm not working out. Your body says I don't need it. So, and I don't have enough calories to maintain it, so I have to let it go, and it'll catabolize your muscle tissue. I've done this. When I was 14, I overtrained and I didn't eat enough for my activity level for a period of time, and I probably lost 10 to 15 pounds of muscle. I've learned the hard way, and I never did it again. That's why I've always eaten a high protein diet ever since, and I've never had a problem with muscle loss again,
Right.
ever. And that's why I always harp on it.
Yeah.
So, you know, the problem with some of these weight loss clinics in that scenario is it's really dishonest marketing, and you're putting people in a worse position. And I think that's, I've always been anti that, and that's not what you're doing. I'm so thankful for that.
They always gain it back too.
And they always get.
I think that's what's so disheartening is all of the people that I've helped over the years, and we helped together.
Yeah.
They say, well, I lost 50 pounds doing that, or I lost 100 pounds, or whatever, and then
And you're
I
like,
did
what
good
happened?
for a while.
Why'd you gain it back?
But then I gained it back, and sometimes it's not just they gained that weight back; they gained more.
You lost muscle. The muscle doesn't come back because you're not weight training.
Right.
You now are you have more fat and less muscle than you had before, so you're a worse body composition than when you started.
So we're trying to like avoid that because we know how disheartening that is.
Because it's dishonest and
then
it's
to top
not,
it all off,
it's not ethical.
These people that this is happening to, I don't know any of them that's had their blood work checked the way we are. So
they don't check the blood work.
They've probably got deficiencies at the the nutrient level.
Right.
Lord knows.
Which
what
affects your
thyroid
long-term weight
issues
loss
they
and health.
have or hormone. So it's like a vicious cycle.
Right.
And it affects your mind too, and then you're depressed, and then you don't have the energy to go work out. Like it's
Well, nobody
we're
else.
trying to break that cycle.
Right.
Like that's what we're trying.
So don't think of it just as weight loss. Then it's a metabolic
reset,
a metabolic like rebuilding because.
Probably need to just change the name.
Well, it is. It is. The goal is weight loss because weight loss is marketable, you know. But
yeah, and I don't like gimmicky stuff. So I don't like weird names.
But it is a metabolic because if you don't fix the metabolism long term, if you don't learn how to eat properly, the right whole foods, you can have an Oreo every now and then. You just have to be in control.
That's what I want to say. We don't like to deprive people.
Yeah.
So I don't have this like rigid plan where it has to be grass fed this and
that's stupid.
And then it can't do this, you can't do that.
Right.
Like if I place all these limits on you, then how are you going to be successful? I like to meet you where you are, and then let's go from there.
Right.
If somebody's like, well, I just need you to tell me what to do and I'll do it. Okay, fine. But still, I
want you to understand what we're doing and why we're doing it.
Why you're doing it. Like you should be able to go, like if you go to a birthday party and every blue moon and you want a piece of cake.
Sure.
Don't be like me, what I used to do. Eat about 3.
Right.
Because I'm like, I never get to have any poor me, and then I'd eat it all.
Or the trap people fall into.
You have to learn. You just eat that, and then you're fine. You're going to be fine if you tell yourself no sometimes. That's another thing. It's like, I didn't want to tell myself no.
Or people will say, I already had that piece of cake. I might as well have the regular Coke.
No.
And I'm going to go get the biggie size meal on the way home too, because I've already blew my day.
I have to say this. We don't say, oh, this food group is bad. You can't have sugar. You can't, we don't say all this is bad. We are sticklers on what people drink.
Oh, you should never drink sugar.
You should not drink your sugar. Like if you
absolutely
had to have a sweet tea once a month when you go to this specific restaurant and you don't get your glass refilled, then that's fine.
Brought to you by Coke Zero.
Who are drinking, sweet tea every day, sun drop, all these things every single day. It's empty calories for no reason. If you go to the restaurant, they're getting refills. So you're adding 500 to 1,000 calories on easy just at that meal.
Sweet tea.
So people, I was in mindset. Like when we were before we got married, I was like, well, I'm already eating bad. Why can't I have this drink? And you're like, do you really want to put
I got in your car and I said, is that a regular sun drop?
It's like almost like red flag. I shouldn't date her.
I was like, that was about to be a deal breaker.
Yeah.
But she switched to diet sun drop.
And now I don't even like it.
I still remember that. I was like, is that a regular sun drop?
You drink regular drinks? And I was like, yeah, don't everybody?
Oh, my judgment worked.
But yeah, so that's one thing we are a stickler on because we know that it's sabotaging you. You're not even having to chew it and break it down. You're just drinking it. It's going straight in. It's raising your blood sugar. It's bad.
Your body has no way to regulate how much you've had. So you could literally drink 10 glasses of sweet tea and not feel full So you just drank. You just
And
drank.
I feel like that's how crackers are too. Crackers, chips, all of those things, you just eat them.
Yeah, they
and
don't.
you're never full.
You're never full.
And that's why we don't buy it. We don't even buy it for our kids.
No.
Now they're not perfect.
Yeah, well, if
eat
they do,
pizza
they
in
get
school.
they get a snack size bag. We don't buy family size
We don't buy a
bags.
family size bag because we learned a long time ago. If we buy the family size bag,
Yep.
it lasts one day
Yep.
in our house. So we'll buy little snack bags or stuff like
Right.
that because we know it's like.
But our kids, this is because I was a big kid, and one of my biggest problem was sodas. And the first thing when I started, I started reading like bodybuilding.com, like, you know, message boards back in the early 2000s, you know, and I'm like, you know, all these guys are ripped. Like, I want to know, like, how do they get in that kind of shape, you know? And it was always stuff like eat whole food, high protein, absolutely never drink sugar, never drink sugar, never drink sugar. Get rid of your sodas, sweet tea, all that stuff. I'm like, okay, well, I did that, man, in like 2 or 3 months as a 14-year-old, it was like 6-pack city real quick. I went from fat kid in 6 months to, you know, ripped with an 8-pack, and it was crazy. And I'm not saying that's because that was when I was 14. I mean, you can't do that at 44 or something, you know. I'm 38, but it doesn't work that way. But it's that important. Like the sodas, the sugar, it will destroy your diet. It doesn't do anything for you.
It doesn't help your liver.
Kids do not need juice.
No.
Do not. We've never given our kids juice. We've never given our kids like full-on chocolate milk. We buy the Fairlife chocolate milk, like half-gallon. That's like double protein and like half the sugar.
Right.
So that's sort of a compromise to give our kids more protein.
But don't get us wrong. They eat Skittles.
Yeah, I make them eat it, but
they eat pizza at school. We're not like, oh, our kids
Yeah.
eat perfect. No. So we try
We
to
don't
be
buy-
reasonable. We're reasonable.
Yeah, but if we're going to get Oreos, it's going to be the little packs that have like 2 in them.
Yeah, because we know how it goes if you get a big pack.
Because if you got the big thing, he's going to eat the whole sleeve like I did when I was a kid.
So it's just simple things. It's not these hard and fast like, oh, you can't have this.
But they don't have any weight problems because of that.
No, they really
They're
don't.
very healthy.
I swear that drinking the sugar is the biggest.
Drinking
And they're
on
not
top of
brainwashed, but when they go to a birthday party now or whatever, and there's only regular drinks or like juice or whatever, they won't touch it.
Right, they drink water.
And they would just rather have water. But little, like Harper, he'll be like, well, maybe just a little bit of tea. He might.
Yeah.
But that's about all he has. And that's not because we're like, you can't have it. It's because we explained to them the importance of it from a young age, and we reminded them. And so that way, when they're not with us, they don't go hog wild, but you know, and oh, we'll have whatever. They understand the reason why. And I say, if you want a little bit, you can have a little bit, but we're not going to keep refilling the glasses of sweet tea.
Right.
We did that one time.
Yeah, that was a bad night.
But anyway.
That's a long story.
Yeah, it was a long story. Sweet tea for a 2 or 3 year old can be too much.
Caffeine and sugar for a 2 or 3 year old is not a good combo.
So anyway, anything else you want to talk about?
You want to talk about the gym?